right, welcome everyone. Here at Philabundance, we are celebrating National Nutrition Month alongside Feeding America and the Academy of Nutrition and Dietetics. This year's National Nutrition Month theme is Personalize Your Plate, which is essentially what nutrition professionals help their clients to do based on the most current science around health and wellness. Today, we are excited to speak to Trinique Waters, a Philadelphia-based registered dietitian nutritionist, or RDN. I actually met Trinique several years ago while we were both working in food service, and she told me about her career aspirations and helped to inspire me to become a nutrition educator. So I'm really grateful for that, and especially grateful that she would take the time to speak to us about her work and perspectives on health. So let's get started. So welcome, Trinique.
Hi, Alex. Thank you so much for having me today.
Yes, thank you for joining us. If you can just start by telling us about yourself, your background, and your work in Philadelphia, that'd be great.
Sure. So I am a registered dietitian, like you said, and I've been a dietitian for almost 5 years now. I'm originally from Baltimore, but came to Philly to attend school and just fell in love with the city, so I made it home. And in my work being a dietitian, I've had really different roles so far. So I started in food service management, where I oversaw like a school lunch program, and then I worked as a dietitian at an inpatient rehab facility. So working with people in recovery from drug and alcohol addiction. And now I'm in public health, and I see patients one-on-one, and we talk about healthy eating related to any health issues they may have. So whether it's diabetes or high blood pressure, and we try to make healthy changes to improve their health.
Great, thank you. So you are an RDN. What is the difference between a dietitian, nutritionist, and registered dietitian nutritionist?
That's a really good question, and I get that question a lot. An registered dietitian is someone who has completed 4 years of school at least. Some have a master's degree, have done a year's worth of internship, as well as taken the national exam that we have to take. RDN is basically the same thing, but it's just another title that the Academy introduced to make it a little bit more obvious about what we do. Because when someone hears registered dietitian, they may or may not know what that means, but when you add the nutritionist part to the end of it, kind of pulls it all together for them. But then someone who calls themselves a nutritionist, it's a little bit difficult to know exactly what their background or their education is, because that isn't a regulated term. So, it's possible someone went to school for 4 years and studied nutrition and they work as a nutritionist, but it's also possible for someone to have read a few books that they thought were interesting related to nutrition, and they call themselves a nutritionist. So I definitely tell people, if they're looking for credible nutrition information, look for someone who is a registered dietitian or a registered dietitian nutritionist.
Yeah, that's new information for me. I didn't know that the nutritionist part was added on within the last couple of years.
Mm-hmm.
Great. So for yourself, and I guess for the people you work with, how do you define healthy eating?
That's a good question, and a pretty big question too, because I definitely don't think that healthy eating looks any one way. There are a lot of like diets out there, and foods that people say, once you incorporate this, you're good to go. But it's a little bit more complicated than that, because we have to take into account, like, of course, our health status, any health conditions we have, but then also foods that are maybe part of our traditions or our cultural upbringings. Those also should be incorporated into what healthy eating looks like for everybody. So it's very personal, and sometimes it takes time to kind of get to a place of feeling like you're eating healthy, because it doesn't look one way. But yeah, it has a lot of factors that go into it. Definitely we want to make sure we're getting plenty of vegetables, plant-based foods, whole grains on a regular basis, and other foods like certain things high in sugars or saturated fats. We want to try to keep those in moderation. But again, there's no one way to go about that.
Absolutely. And how you define healthy eating might change over your lifespan
Yeah,
too. So
definitely.
along those same lines, what foods make you feel the best?
So like I mentioned with like foods that are part of like our cultural upbringing or traditional to our background, I think foods that remind me of my childhood make me feel my best. Every Sunday, my extended family, so a large amount of us would get together and have dinner, and we pretty much like the same things every Sunday. But my favorite food from those dinners was definitely the sweet potatoes, and they were made, not the most healthy way with sugar, butter, and all that good stuff. But like I said, those foods are a part of who we are as people. And they're not foods that I have often, especially these days since I'm so far from home. But when I, have foods that remind me of those Sunday dinners, it makes me just feel all good on the inside.
Absolutely. I was always asking for marshmallows on the sweet potatoes. So I'm there with you. So we are receiving at Philabundance, we're receiving a really generous donation of frozen salmon this month. And we also carry canned tuna and salmon year round. What are some ways that you enjoy eating fish?
So with salmon, I really like to make it with a honey and soy type glaze. Usually I'll let the salmon like marinate for half an hour or so. Um, with the soy, I usually do like the low sodium soy sauce, and add a couple other herbs like some ginger into it, a little bit of garlic. And then after I marinate it, let it cook on the stove, usually in a cast iron for a few minutes, and then also broil it in the oven for a few minutes after that, so it gets a nice like crispy um, coat to it, and then retop it with any leftover glaze that I have, and whatever vegetables I have available, I'll serve it with that. Usually like some brown rice on the side as well. With canned tuna, I like it pretty simple with like a little bit of mayo and some relish and Old Bay because I'm from Baltimore. So, and then I'll have it usually on like whole wheat crackers or whole wheat toast and eat it like
That's great. And if anyone missed it, we did a fish four ways cooking demonstration on March 11th. So be sure to check that out. We'll post the link. But we had a lot of fun with that. And as we said earlier, this year's National Nutrition Month theme is Personalize Your Plate. So what is one way someone can personalize their plate and meet their healthy eating goals?
Yeah, good question. So, I think it's important first to get an idea of like what goals you're trying to work towards. So, if you're trying to get more vegetables in or trying to lower your sodium or your sugar intake, um, just so you know exactly what you're trying to really aim for. And then using my plate as a really helpful guide to 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 guide you. So, we got our 5 different food groups: fruits, veggies, grains, protein, and dairy. And I try to recommend that people aim for at least 3 of those food groups, one of them being like a fruit or a vegetable with their meal. So if they're able to get those mixture of food groups in there, and then let's say their goal is to eat more vegetables, add some extra vegetables onto your plate. So start easy like that.
Excellent. So speaking of food groups, whole grain sampling day is March 31st, and whole grains can be a tough sell for a lot of people. What do you suggest to people who don't like whole grains like brown rice and whole wheat pasta?
So there are actually a lot of other whole grain options available. Brown rice and whole wheat pasta are usually the most easily accessible, and probably most well known by people. But definitely whole wheat couscous is a good option, quinoa, and there's also other ones like teff, kamut, amaranth that you might have to go to a special part of the grocery store to find, but you definitely can, and they're all somewhat similar to rice, but some of them have different tastes or different textures. So there are different options out there to incorporate whole grains besides whole wheat pasta and brown rice, but it just takes a little bit of digging and maybe a little bit of research to try to find a good recipe for them. I really like Old Ways. They have a great website with tons of recipes that incorporate these different whole grains. So I often recommend people check out the Old Ways website for those recipes, and they also have cooking demonstrations that could inspire someone to try to prepare them themselves.
Yes, Old Ways is one of my favorite places to find recipes. And they also have the Whole Grains Council, so we'll post those links. But the key with whole grains is definitely finding what you like. And the nice thing about whole grain couscous, like you said, is that it takes, what, 5 minutes? So that's really nice,
Yes.
as opposed to 40 minutes for brown rice.
Right.
So a little less planning. This is one of my favorite questions to ask people. What are nutrition myths that you hear the most often?
So probably the myth that I hear the most often is that any type of carbs are bad. And carbs is short for carbohydrates. And people often think they're bad because they turn into sugar and too much sugar isn't good. So it's partially true. So all carbohydrates do break down into glucose, another word for sugar, once they're digested. And our bodies do need some sugar. That's energy for our bodies. So we do need to incorporate them. But the issue really comes in depending on the source of those carbohydrates. Like if we're choosing like refined grains too often and not enough of those whole grain options, like we mentioned. And it's also very easy to consume a lot of added sugars in like a standard American diet. So, it's just important to be mindful about the sources that we're choosing for our carbohydrates and for our sugars, and also being mindful of how much we're having at each time. Um, Another myth that I often hear tends to relate to the keto diet, because it's kind of like a new fad diet that a lot of people are trying, and some people are trying it and finding success with it. However, with the keto diet, first, the keto diet was created for children who suffer from epilepsy. The high fat content is very helpful for them, and when they're following it, they're often being followed by a doctor and a dietitian at the same time. Versus other people who try it, it may or may not work best for them because of certain health conditions they may have, and they're not being monitored by a physician or anything like that. And it's also somewhat difficult to maintain for a long period of time. And when we're making healthy changes, we want to make them sustainable, so easy to stick to for a longer period of time so we get the most benefit from them. And if it's something that we're going to do for 2 weeks and be successful, but then not be able to stick with it, it may not be the best option for us to try in the first place.
Yeah, that's really interesting. Thank you for clarifying that. You can also find more about nutrition myths by testing your nutrition knowledge on the National Nutrition Month quiz, which addresses some of these things that you just talked about, Trinique. So we'll link to that as well. But yeah, there's a lot of myths out there, I think, and sustainability with eating is key.
Mm-hmm.
That's the issue with so many diets, that they really aren't sustainable over the lifespan.
Mm-hmm.
So you work at a city health center in Philadelphia with many patients who receive SNAP benefits and rely on food pantries. What are some misconceptions that you think the public has about your patients?
Probably the biggest misconception is that many of the patients that I see don't care about their nutritional health or the health status, or don't have a desire to purchase, healthy food options that are nutritionally dense. But I do see a lot of people who do care. But when you take the time to really listen to people and learn about more than just like what they're eating, but what their whole life looks like, you understand that there's so many like competing priorities in someone's life. I think especially right now with the whole COVID situation, people are really just trying to survive. So one of the last things that people are thinking about is, getting an extra scoop of vegetables on their plate, or even making sure they have a meal, once a day or twice a day. So, it's really important that when we are encouraging people to make healthy choices or make healthy changes, that we understand more of the full picture of their life, and also don't demonize, the choices that they're currently making, because they're not making them because they want to make, poor choices or because they don't care. But everyone's just doing the best that they can at the moment.
Yeah, it's so important in healthcare to listen to what the patient is saying. I think we've all been on the other end where, we're a patient and we really want to be heard and validated. So what resources can you recommend for people to learn more about healthy eating?
So definitely eatright.org. That is the website of the Academy of Nutrition and Dietetics. So you can definitely find different articles and recipes. And because it's coming from the Academy, which credentials registered dietitians, you can be sure the information is credible and evidence-based. Like I mentioned before, Old Ways is a really good resource as well. And then also people should definitely check with their insurance plans, because these days often many insurance plans offer free visits with a dietitian. So, you can give some direct and one-on-one attention to try to work on any nutrition or health goals with a credible professional. And last thing that I would mention to that also is just to be careful about nutrition information, because it's very widely available online. But like we mentioned, not all of it is credible information or coming from somebody who has that education and background. So just doing a quick Google search may or may not give you the safest piece of information. So, asking your doctor, or like I said, trying to find a dietitian for yourself is always your best bet.
Sure, it's good to be skeptical, even with books.
Yeah.
Sometimes you need to do some research about that book that was published. So how can people find an RDN near them? Or right now, I guess it'd be telehealth, but how can people find an RDN?
So definitely through their insurance, they can. If you call them up and see what your plan offers for free visits, they should be able to direct you to dietitians in your area. And I believe also on the Academy's website on eatright.org, they also have a part where you can put in your zip code or your address and see what dietitians are in your area as well.
Yes, definitely. So we have a couple questions left, and we'll call these quick bites or rapid fire, whatever you want to call them. So might be a little bit what we've already talked about, but what's your favorite place to look for quick, healthy recipes? Weeknight, you don't want to do too much.
I like the Old Ways website, and I like it because a lot of their recipes, they're like different, so you don't have to keep eating like the same things over and over again. But a lot of them also don't have a ton of ingredients, so you don't necessarily have to have like specialty stuff in your fridge to prepare them. Yeah, I like the Old Ways website for recipes.
Awesome. What can people eat to satisfy their cravings for sweets without overdoing
So fruit
it?
is always a great option. We have some natural sweetness in that, especially if we can like balance it out with some kind of protein, whether it's like nuts or seeds or a Greek yogurt. Make it a nice balanced snack so it's filling too. But I'm not against anyone having sweets here and there, but again, being mindful of how much we're having is going to be really helpful for us in the long run.
Absolutely. And what is a healthy habit you've seen more people pick up this year?
I've seen a lot more patients who are just taking the time to think about their eating habits and increase their mindfulness around their eating habits and their food choices. And I think because COVID has shown a lot of people that health is just so important, and it's something that some of us can take for granted. And a lot of people are just paying attention to the fact that food can impact your health. So definitely increasing the mindfulness, which is I think is a great first step for trying to make healthier choices.
That's wonderful. Yeah. There's a lot less distractions right now if we're stuck at home, and I think that's a really good point. So I'm curious, from people who are watching, let us know a healthy habit that you've picked up in 2021 or before. And you can tag Philabundance and use the hashtag National Nutrition Month to let us know what is a healthy habit that you've picked up in 2021. It's good to reflect on a positive this year and be grateful for what we have and the good things from this year. So very grateful to Trinique for joining us today. And I hope you all have a great rest of March. Take care.